maintenance on the hemogram machine. This is the hemogram machine. So this is our control blood sample. I already warmed it up so that the sample is homogeneous. But so the machine, if you look, is naturally asking for us to do a cleanser. And so what you want to do is, this is our probe cleanser. You just take it and the probe right here, you put it right over there. And so you hit, yes, you put it right over here, and then you hit the button, and if you hear it beeping, it just sucked up some of this cleanser and it's going to run it through the machine. So the next step is, so you hit next sample, and then so there's a number there right now. You want to backspace that and put it's BG for background. And then it says species. Right now it says dog. You want to change that to background 2. And then hit OK. And then with no sample, you're going to hit the button. And it's going to process this. And it's kind of going to make the machine go to 0, so that when we're actually going to run our sample, it'll have, you know, like a level base to go off of. So if you look, there isn't any numbers in the green, in the red. So when it is in the red, something is too high or low. So that means we're good to go on to our quality control. So this QC, you hit that button. So what you're going to do is just take the top off and put the tube up to the probe. Make sure that the probe is in the liquid. Hit the button. Let it suck up some of the fluid, and then you wait for it to run. Alright, so now it's done running. If you look at the sample, so all the numbers are in the green area, so that means that our control is set. And we're going to do our ELISA test next. We're going to do a CPLI, which is a test that tests for pancreatitis. And so what we want is serum. So I got some blood from a dog, and what you want to do is you got to spin it down so that you can get that serum. Now our serum is done. If you look, it's got the separation, so the blood cells, and then the serum is right here. So for the CPLI, this is our conjugate. You're going to put 4 drops of conjugate into the tube. So 1, 2, 3, 4. This one, you want this to be room temperature. And then this is our CPLI. So just take the pipette and put it into your serum. This one you want 3 drops of. 1, 2, 3. You want to try and get a homogeneous sample, so you just kind of flip it a couple times. And so if you look, it's not snapped yet. What you're going to do is take your sample, pour it into this little well right here, and then when you look in a second, the fluid, as you can see, is coming down, and when it gets to the point of this circle, you're going to want to snap it. And if you see, it's starting to get in that blue circle, so you're good to snap it. And you have your timer. It's set for 10 minutes, so you hit start, and after that 10 minutes is done, there's going to be 2 circles, and we can see what the result will be. Our CPLI is done. So if you look on the left side, that's our control dot, and the right is the dot which tells us if the patient has pancreatitis or not. So if the left, which is the control, is darker than the right, then that is a negative result. If the patient was to have pancreatitis, then their sample dot would be darker than the control. So overall, negative result. We're going to do our direct fecal smear. So all of our supplies, we need saline, a wooden applicator stick, we've got our slide cover, and then we've got our microscope slide. So the first step is to put a drop of saline on your slide. And then after you do that, you want to take your wooden applicator stick, put it in the stool, and kind of get, you don't need too much, just a tiny little sample. And then you're going to put it in the saline and kind of mix it up to make it homogeneous. So once it's all mixed up, put that there. We're going to put our microscope slide on top. And make it to where it's not too high. So, and then once you're done doing that, you're gonna take it over to your microscope and look under it and try and see if you can find any parasites. Now we're gonna do the fecal flotation. So I have all my supplies set up. So first, what we're gonna do is we're gonna take a little sample of our stool and put it in our little Dixie cup. And then after you do that, you want to add roughly 30 mLs of the fecal solution. Alright, so then you're going to take your stick, which I'm going to switch to my tongue depressor. You're going to smush it all around and kind of make a homogeneous mixture. Alright, so if you look, it's kind of like a watery, mixed up fecal solution. So after you do that, you're going to take, so I have my little tube and you've got a funnel, so you're going to put that right in there, and then you're going to take a gauze square as like a cheesecloth and put it right inside. So what's going to happen is it's going to filter out any huge chunks, and all the liquid will go through into the tube. So might take a minute because it's got to go through the cheesecloth. So, and in the end, what you want is at the top of this tube, you're gonna have to take that filter or the funnel out, but it's gonna get a little meniscus. So it's got to be pretty full. So if you look, there's a little meniscus. I don't know if you see it. It's a little rounded edge. That's where we're going to put our microscope slides. You're going to take it, put it right on top. And then what I like to do is kind of push down on it so it sticks. And then you're going to let that sit there for 10-20 minutes, and afterwards we're going to come and take that and put it onto a slide and look under the microscope. About 15 minutes, so I'm going to take this slide, and literally all you do is lift it off of there and then put it onto your microscope slide. And then now we're going to go and take a peek under the microscope to see what's on there. I'm going to do a centrifugal flotation. So what you need is our supplies are all right here. So we're going to take our stool sample. Alright, so then after you get your sample, we're going to add again about 30 mLs of our fecal solution. So once it's all nice and mixed, you're gonna we're gonna use our same thing like with the flotation, the funnel with the cheesecloth. So just put this is just a gauze square, but put the gauze square in there, and then put your funnel in your tube, and you're gonna make a little V with your cup and pour it in and look for that meniscus. We're again looking for that meniscus, so there's that. And then you're gonna put your slide cover right on top. Like I said, push down. And then so for our second tube, it's just a balance. So all you got to do is take your fecal solution. Alright, so now you got your two samples. You're going to take it, we're going to come over here to our centrifuge, and you're going to put one across from the other. And I like to double check to make sure our slides are kind of sticking really well, because if they don't, then they will fly off when the centrifuge starts. So you're gonna do, so when you shut this and you start it, this number, that 0, will turn, you want it to go to 1500 RPMs. And then once we do that, so you're gonna do it for let's see, I think it was 6 minutes, and once that 6 minutes is over, you'll take the slide and put it on your microscope. After the centrifuge is done, you will take the microscope cover and the slide cover and put it onto your microscope slide, and then look on the microscope to see if anything is found. Alright, so now we're going to do sedimentation of your stool sample. So with this one, you're going to get, you know, a small sample and put it into your Dixie cup. And then instead of washing, you're going to wash it with water instead of your fecal solution. So you're still going to make a homogeneous mixture. Use a gauze square as a cheesecloth and put it into your tube. You're going to filter all the liquid out. You have your meniscus, and you're going to put your slide cover over there. Again, push down on it. So this is going to sit there for about 15 to 30 minutes, and we're going to come back and take off the supernatant. We waited about 20 minutes, and you're going to suck off the supernatant. So if you look, that's your sediment on the bottom, and so you're going to take all this liquid off. Once you're done getting the fluid off, we're going to resuspend it in some more water. But you want to try and not disturb your sediment on the bottom, because you want to keep as much as you can down there. Now you're going to take your water again and just fill it up all the way. Alright, and then you're going to wait again 15 to 30 minutes. And then you're going to repeat it 2 more times. And then once you repeat it 2 more times, we can take the fluid off, the supernatant, and take a sample of the sediment and look under the microscope to see if there's any kind of parasites or anything in there. We did 2 more times of the flushing, so now what you've got to do is take your pipette and suck all the supernatant off, and then we'll get to the sediment and then take a sample to look under the microscope. So now that that's all gone, I'm gonna take a fresh pipette, and you only want a tiny sample, so that it says an aliquot. So you take a little bit of your sample, get your microscope slide, and then you're gonna put that drop on here, and then put your microscope slide cover on there, and then you're going to take this over to the microscope and take a peek to see if you see any parasites or any abnormal bacteria or anything that could be infecting the animal. I'm going to do an ear cytology for a dog. So what you want to do is you want to take their ear and put it back on their head. So then you take your cotton swab and you want to go in and kind of get a good sample. Make sure you have a good amount of cells on it. So like this has a good amount. There's not a ton to begin with. So and that is the right ear. And then what you want to do is do the same for the left ear. Alright, so now that you got your swabs, you want to try and put it on a slide so you can look under the microscope to see what's on there. So you'll take your left and put it next to the frost. So you want to roll it on there. You don't want to drag it because it can break up the cells, and you don't want to make it too thick either because then it makes it hard to view on the microscope. And then you just put a little space between the two so the right is on the other side. Do the same thing, kind of like a rolling technique. Alright, and then we're going to go and go in the lab and stain this. Alright, so now we're going to heat fix the slide so that the wax doesn't make it hard to view. So you don't have to do it for very long. And then what I like to do is I like to wipe because I kind of get that black burnt look on the back, I like to wipe that off so that it's not impeding my vision. So now what we're going to do is we're going to take it and we're going to stain it, 3-step stain it. So it's got methanol, eosin, and then new methylene blue. So the first step is the methanol. So you put it in there, you want to mix it around. What you do is now you go do the same thing with the eosin. Take the excess off and go into the new methylene blue. Alright, so now we're going to put it on the microscope. So you're going to take your slide and put it on the stage. Turn the light on. So we're going to start off at 4x just to make it to where we can focus in on whatever we're looking at. And I'm going to focus. That's pretty good. So you kind of want to move up through the levels to focus in. It makes it a lot easier. So that was 10x, I'm going to 40x now. And then the next level is oil. You're going to put a little oil. It makes it to where you can see the cells on the slide a lot better. And that's just immersion oil. Alright, cool. So, with any cytology, you want to look at quite a few fields just to make sure you have a good, accurate count of what you're seeing. So right now I see it's like 3 or 4 skin cells. There's a little bit of waxy debris, but it's not any kind of bacteria or anything. And so I just moved over and I see 1 yeast bud. So maybe have a mild ear infection, but it's the first one that I've found, so I'm not seeing any cocci or rods or anything, so that's good. So that was the left side. So I just saw 1 yeast bud. Start on the right side and do the same things. Quite a few skin cells on this very first field that I see. That's normal. Your cotton swab just takes the dead skin cells with it, so and I'm not really seeing much on this side either, so just slowly scanning. On this field I see 2 yeast buds. They're kind of sitting right next to each other, so there's a couple on that. Alright, so I think that's about all I see. So yeah, other than a couple of yeast buds, I'm not seeing much of anything. So you still want to report that to the doctor, just because they may want to suggest like weekly ear cleanings, or I don't know if they would want to give any kind of medication for the ears or anything, but yeah, it's not too bad of an ear infection. Alright, we're going to do our fungal assay. We need our auger, and then we need a sterile forceps. So if you look at this dog, it's got some patchy areas, and the owner is kind of worried about ringworm. So we're just going to pluck some hair and then put it into our assay. Try and get some of the skin cells. So once you have that, you're going to open that. And then you want to indent it just a little bit into the media, and then once you're done with that, you put the lid back on, and you're going to re-loosen it, and then we're going to wait for about 2 weeks to see if it ends up being positive for ringworm or not. So we are going to examine our fungal assay under the microscope, and as you can see, nothing grew really, and the auger is still orange instead of red as if it would have grown something. So just to make sure, we're going to do the normal setup. So what you want to do is take the lid off, and we're going to use some cellophane tape to try and stick down in there and stick it to our sample. Alright. So as you can see, it's got, you know, on the very edge, it's got some of our cells and whatnot on there. So, so you're gonna take your tape and put it on your microscope slide. And then what you're going to do is you're going to use lactophenol cotton blue on the top, and then we're going to look at it under the microscope. Put a drop of our lactophenol cotton blue onto our slide, and then look under a low power to see if we have any fungal spores and any kind of activity that you would expect with things such as ringworm or so what you're going to do is go over to your lactophenol. Like I said, you're going to look for spores or any kind of like a fruiting body, and sometimes fungus is kind of stringy looking, so and that lactophenol lets you see that. So I'm not expecting that we will see much due to the fact that our DTM didn't change colors, but it's definitely worth looking at because you don't want to have any doubts in your mind that it's a negative. So yeah, so far I'm seeing a little bit of debris, but I'm not really seeing much of anything, no growth or fungal activities. I'm going to say that this fungal assay was negative. Okay, we're going to do the skin scraping. So if you look at this cat's neck, there's a lot of scabbing and really bad looking areas. So what we have to do is we're going to take our slide and a sterile blade, and we're going to put some mineral oil on it. So what we do, you just put a little dot on your slide, and then you want to kind of tap it on both sides and get some on there. And then if you look at the cat's neck, so what we want to do is we're going to go on the outer edge and scrape. So what you want to do is kind of scrape until you see the serum kind of seeping out and some blood. Squeeze it. Alright, so if you look at your blade, there's good amount of cells on there. So you take it back to your slide, and you want to get all that on your slide. And then we're going to try and scrape another area. So then you're going to add that to the slide too. Alright, so and we're doing a superficial scrape just so that we can look for things like Demodex and Sarcoptes, and so now we're going to go look under the microscope to see if any of those are there. Okay, so we're going to take our slide and put it on the microscope to look for the Sarcoptes or the Demodex. So you just put your slide on your stage and then turn the light on. I'm on 4X right now. If you have any kind of live ectoparasites, they should be visible on this magnification. So what you're going to do is you're going to focus, and so far all I see is there's like hair and there's a little bit of blood. I want to make sure you take a scan of the whole slide because you don't usually get too many, and you don't want to miss any of the possible parasites. So far nothing. So I'm not seeing much of anything. So I've scanned over the whole slide. So I'm going to say that this skin scraping is negative. We're going to do a necropsy on a feeder rat, and the protective wear you need are gloves, some kind of gown, and a mask, just so that in case anything splashes, you're covered. For a little rat, you're probably not going to get too messy, but some of the bigger dogs and that can, body materials can kind of get on you. So These are our biopsy jars that we're going to use for our specimens. The basic instruments that we're going to use during this is a mixture of scissors and forceps, and then if you needed a blade, and then that would definitely be on the side too. So otherwise, we're going to get started. So Dr. Duncan's going to help me out. So he's going to start by doing his external exam.
Looks to be in pretty good health. I mean, there's really nothing musculoskeletally wrong with this animal. I'm not sure exactly how it passed. Everything externally appears normal. We'll do our internal exam. We're gonna get started right now.
I have two extremely long ones I have to play with.
Alright. Just a midline incision, so at that point continue it up into the thorax, just investigating pretty much every single one of the major organs. Liver, I'm going to take a liver sample right now. And look at the heart. Collect this as the first sample. That would be a block. That's it.
So as you saw, Dr. Duncan went through all the major organs and looked at them to make sure they were not abnormal, and if he did think they were abnormal, or if he saw anything that could be a sign as to why the animal died, that's when he took a sample. So the two organs that he took from were the liver and the heart. So what you want to do is take your jar, and this rat doesn't have a name, but you would put the rat's name. So I'm just gonna call it Jane Doe, and then you want to write where you got the sample. So for this one, you write heart, and then you would do the same thing for the liver. And the reason why you want to label each biopsy jar is so that nothing gets mixed up, and that you're positive which sample is which. Rabies submission handling. So what you want to do should be maybe a doctor and just a technician. What you want to do is take the animal back to maybe like a wet table, surgical table. You want to have on gloves, you want to have a surgical gown on, and maybe even eye protectant, so that in case body fluids splash by chance. And so what they're going to do is, when you do a rabies submission, you submit the head for evaluation, because so for us, we would send it to MSU, and they would take the brain tissue and sample it. What they would do is they would cut the head off, and this is the jar that it would go in. So you would put the head in this bag, and then you snap down this shut, and it would go in this box, and you ship it. It depends on the company, who they, or like MSU, they do I believe UPS, so it can do UPS or FedEx. You put it in the fridge, and when UPS comes, you just give it to them, and they should get it in a day or two, so that they can start testing on the samples. The rest of the body that you have, you want to cremate. Otherwise, yeah, the most important thing is you want the least number of hands and people near the animal, just in case it is rabies, because it is such a deadly disease. We're going to do a vaginal cytology. So I've got all our supplies. So what you want to do first is wash the vulva, just kind of getting all the outside bacteria off the vulva so that it's not contaminating our fresh sample. So this is just saline. Just gonna wipe the outside, just so that there's not any extra stuff there. So, and then if you see, I have my sterile Q-tip. And then once you get one of these out, you're gonna put a little bit of saline on here. And then what you're gonna do is insert it at the top portion of the vulva. You don't go too far in, you just go right on the inside, kind of twist it around a little bit so that you have a sample. And then you take your microscope slide and you roll it out. So now that our vaginal cytology is dry, we're going to use our 3-step stain to stain it. So first you're going to go in methanol. This is a fixer. The next one is going to be eosin. Put the lid on the methanol. So this is methylene blue. Now we're going to rinse off our slide. And now we're going to go look at the slide on the microscope. Now we're going to look at the vaginal cytology on the microscope to see which stage of estrus this dog was in. So you're going to start off with your 4x magnification. And we're going to try and focus in. And you're going to go to the 10x. Do the same thing, is just try to focus. You'll see the cells get a little bigger with each step. Now we're on to the 40x. I'm going to go to the oil, so you just put a little drop of your immersion oil on the slide, and then go to the oil lens. So what I see already is there's like a little grouping of red blood cells, and it looks like some rounded nuclear parabasal, or maybe one, just like squamous cell. They don't look quantified yet. Let's see. So what I'm not seeing is a ton of neutrophils, so that's a big clue right there. Just, rounded parabasal cells. So I'm seeing a couple of the squamous cells, and they have pycnotic nucleuses, which usually you would see in proestrus. I'm only seeing a couple of neutrophils and a handful of red blood cells, so I'm leaning towards proestrus as far as which stage the dog may be in. Yeah, it's looking like, parabasal cells and some of those squamous cells. I found one anuclear cell, but there's no bacteria, so that's a good thing. So I think I'm all set looking at the slide. So I am going to say that this dog is in proestrus, the proestrus stage of the cycle. The first stage of estrus is anestrus, and with this the vulva is not swollen, and the cells that you may see are parabasal cells. You would see neutrophils. You would also see some non-cornified squamous cells. So the one thing that you may not see is erythrocytes with this cycle. Stage of estrus is proestrus, and during this stage the vulva is swollen. There's things like red discharge, and you'll see that the female is attracting males now, but she won't quite yet let the male do anything. So some of the cells that you'll see is a very increased number of erythrocytes. You might see a little bit of neutrophils, but not too many. And you'll see some basal and parabasal cells in there. During the later stages, you'll see some intermediate cells with pycnotic nuclei, but generally the number of erythrocytes will, in the end, decrease, and you'll start seeing cornification of the cells. Third stage of estrus is estrus, and it's an average of 9 days long. And what you'll start seeing is a pinkish vaginal discharge, and she will start now letting the males come around. You will see a good amount of anuclear cornified squamous cells. You'll see a small amount of erythrocytes, and then you'll notice that the neutrophils are absent in the beginning. Near the end, you'll notice that there'll be a decreased amount of erythrocytes, and then rapidly the neutrophils will increase, and then you'll know that you're close to metaestrus. The stage of estrus is metaestrus. This can last for 2 to 3 months, and what you'll see is a decrease in discharge and swelling of the vulva, and the female will no longer be receptive to the male. What you'll notice is with the cells, they go from a cornified squamous cell to a non-cornified squamous cell. There won't be any erythrocytes present, and usually it's kind of hard to differentiate between metaestrus and anestrus. So we're going to do our cross matching. So first what I did was get some blood from our two animals. So we're going to get a purple and a red top from each so that we can get our serum and our plasma. So what you want to do is you want to write the names on all the tubes of each animal so that you don't get them mixed up. So we're going to centrifuge these and then pipette off the plasma and serum. Alright, so after spinning your samples, you're going to take your serum and separate it into, so we don't have plain red tubes, we have plain white tubes. So I'm just going to take a pipette and transfer the serum into the white top tube. And this is for Clancy, so, and I've got all the tubes labeled. So if you look, it says, Clancy Trudgeon, and it says serum on it, so that I know exactly what this is. So I have Clancy all on the left and Queenie all on the right. So we're going to do the same thing with Queenie's serum. Alright. We're just going to keep that aside for the later part of the test. So, so right now what we're going to do is take our plasma and decant that. I'm going to put it into tubes just so that I have it. So, again, with a pipette, you're going to take your plasma and then put it into our tube, leaving just the blood cells on the bottom. We're going to put that right back there. We're going to have our plasma on the side. We're going to do the same for Queenie. Alright, so next what we are going to do is take a couple drops of our red blood cells for each of the plasma, or the purple tops, the EDTA, and we're going to put it into our empty tubes, and then we're going to add some of our saline solution. So, let's see, I'm going to take the lid off. So, I'm doing Clancy first. Just go right into the red blood cells and suck some up. So that was not quite enough. That was one drop. Alright. So now that you have that, put the lid back on. And then we'll finish with the saline. So you got to fill the rest of this test tube up with saline. And what this is going to do is wash the red blood cells, the erythrocytes, once we centrifuge it. And then we're going to put the lid back on. Alright, and then same thing for Queenie. Now what we're going to do is we're going to put this, both of them into a centrifuge for 1 minute at 3,400 RPMs. Alright, so now we're centrifuging, as you can see we're going up towards 3,400, and like I said, this would be for 1 minute. So as you can see, we are done centrifuging, and the blood cells have went to the bottom of the test tube. So what we're going to do is decant the supernatant off, and then we're going to wash it again with the saline, centrifuge it, wash it again, and then centrifuge it. So 2 more times. After doing 2 additional erythrocyte washings, you can see the supernatant is clear and all the blood cells are on the bottom. So now I'm going to take off that supernatant, and then we will make our 2% erythrocyte suspension. We're going to make our 2% erythrocyte suspension. So what you're going to do is take 0.02 mLs of the blood cells, and then 0.98 mLs of the just regular saline. So we're going to do Clancy first. So the supernatant, I already sucked it off, so I have a 1 ml syringe that better measures the 0.02. So you just stick your syringe right in the blood cells. 0.02, so it's a very small amount. And you put that right into your labeled tube. I'm going to put this one back there so that I know that I did that, or that's not the one I'm using right now. So for this one, you just want 0.98 mLs of saline. So I have my 0.98 of saline, so I'm going to put that in with my erythrocytes. And now that's done, we are going to do Queenie's. So alright, so now that we have these done, we are going to add some of the serum to the tubes. Queenie is going to be the recipient, so we're going to take 2 drops of her serum, and we are going to put it into a new test tube. I wrote on it major cross match because that's what we're doing right now. 1, 2. And then what we're going to do is take 2 drops of the donor suspension that we just made, the 2%. So we're going to take 2 drops and we're going to put it in with Queenie's serum. So 1, 2. So for the minor cross match, we're going to take 2 drops of the donor serum and put it in a new test tube. 1, 2. And then we're going to take 2 drops of the recipient's erythrocyte suspension and put it in the same test tube. 1, 2. Alright. And so next we're going to make a control. For the controls, we're going to do, so the donor control is going to be 2 drops of the donor serum, and you put 2 donor drops of the erythrocyte suspension in the same tube, because it's the same animal, so their blood should not have any reaction. So, so we'll take the serum, 2 drops, so 1, 2. And then we'll take 2 drops of the suspension. Alright. And so this will be our control that we can compare to the mix just so that we can check for agglutination. So we're going to do the same for Queenie. So 2 drops of her serum and 2 drops of her suspension. Okay. 2 drops of the suspension. So now that we have our controls, we're going to take those and compare it to the tubes that we had mixed the samples. We're going to set our sample tubes out for 30 minutes at room temperature to let them incubate, and then afterwards we'll take a look at them. We've waited 30 minutes, and now we're going to take these, the controls and the solution, and take it to the centrifuge for another minute at 3,400 RPMs. So now we're done centrifuging and we're looking for hemolysis. So these are the control, and as you can see, there's no hemolysis of the supernatant. If you look over here, there's just a tiny bit of rose color to the supernatant. So what we're going to do is take it and we're going to kind of hit it with our finger lightly to see if any visible clots come to the surface. So this is going to be the major cross match. So you know, there's a little tiny floaty, but I mean there's not like a huge chunk coming off, so I wouldn't consider that agglutinated. So this is the minor. You know, there's definitely one floaty that came to the surface. So since it's kind of not really definitive, you know, I would definitely suggest looking on the microscope. So what we're going to do is take a sample, put it on a microscope slide, and then take a peek to look for grape-like clusters, which would indicate that it would not be a good match for these two to donate and or receive blood from each other. Right now I'm looking at the minor cross match to see if there's any agglutination. So started off at our lowest power, 4x, like clusters, which definitely seeing big clumps of blood cells. There's not like scattered throughout like you would normally see. Yeah, so since they're all clumped together, that typical grape-like structure, those little agglutinated spots that I was suspicious of when I, you know, just tapped the side of the tube was definitely a clot. So I would not suggest them donating, Clancy donating and Queenie receiving, because it would not be a healthy outcome for her. So right now I just switched to the major cross match. So we're gonna see what we see on here. So yeah, these are again clumping together, and there's a lot of, there's, you know, some random ones that aren't clumped together, but I would say more than 75% of them are in that grape-like structure. So I would suggest them finding another donor for Queenie.